Classifications of proteinuria are kind of like very easy to pick out because just from the name you can actually just know the condition, right? So if you know proteinuria is basically what presence of too much proteins, more than 130 milligrams per day in urine, then the persistent type of proteinuria now is more of like, okay, the proteinuria has been there for a very long time. Okay, so we'll be discussing the persistent type of proteinuria under definition. We'll look at the causes, we'll look at the symptoms, look at the diagnosis, we'll look at the treatment and prognosis. So for the definition, we said that persistent proteinuria is a condition characterized by what? Continuous, like there's a continuous, right? Presence of excess proteins in urine exceeding more than what? 500 milligrams per day, or you could just say 1 grams per day. That's what? 1000 milligrams. Now, it has been there for an extended period. That's more than what? 6 months. It's a sign of that if it has been there for a very long period, that means what? There's an underlying kidney damage or kidney disease. Now, talking about a possible underlying kidney damage or kidney disease that can also cause this, it could be that there's a chronic glomerular disease like what? Glomerulonephritis, membranous nephropathy. Could be diabetic nephropathy. Could be hypertensive for nephrosclerosis. Could be chronic kidney disease. Could be kidney damage from toxins or medications. Could be some infections like chronic pyelonephritis and cancer. Right? All these can be possible causes. They're talking about the symptoms here. A persistent proteinuria, your urine will be foamy or frothy. There'll be swelling in your legs, feet, hands, and the rest. There'll be fatigue, you'll be feeling weak. Alright, there'll be weight gain, high blood pressure, decreased urine output. Okay. The diagnosis. How can you be able to confirm that what? Proteins have been there for a very long time. You do urine protein to creatinine ratio test, 24-hour urine collection test, blood tests like serum creatinine, albumin, kidney biopsy in some cases. Treatment is definitely for proteins to be in the kidneys for too long like that. Something is under there trying to cause it, okay? So you treat the underlying cause, you control blood pressure and blood sugar, you reduce the protein intake. Alright, then you give diuretics. If the person is becoming what? Endematous, you give diuretics. Then you can also give what? Angiotensin converting enzyme inhibitors and angiotensin receptor blockers just to slow down the kidney damage. Then as you are doing that, you are monitoring the kidney functions and all that. And that's simply it for what? Persistent proteinuria.